We know that health is more than just an absence of disease, right? Just like pregnancy is more than just the egg and the sperm coming together, right? So for example, let's take IVF for example, right? So you've got, you're struggling with fertility, right? You've got this condition, so you're gonna seek Western medicine for it. And Western medicine it's very reactive in its approach, right? So it's like, okay, well, you can't get pregnant, let's put the egg and sperm together. Right. Yeah. But then, as I said, like pregnancy is much more than that. There are so many other factors that impact, your ability to carry a baby to term. And I think naturopathic medicine sort of, it fills the holes and the gaps that perhaps Western medicine is missing.
Let's talk about eggs, baby. Let's talk about she and he. Let's talk about all the good and bad things on fertility. Let's talk about eggs. Let's talk about eggs.
Welcome to How Would You Like Your Eggs podcast. I'm your host, Dawn Chan, and founder of Soul Fertility. In each of our podcast episodes, we invite women to come share about their fertility experience, as well as medical professionals to talk about how they can support your fertility journey. Today, we've got a very special guest with us, Dr. Ardyce Yik, who is a naturopathic physician. She came back from Toronto in 2008 and is one of the first North American licensed naturopathic physician here working in Hong Kong. So when we talk about fertility, we're always talking about how multifactorial it is and that we need holistic care. And so it would be super interesting for us to talk about how naturopathic medicine would be involved in that. Dr. Ardyce Yik, welcome to our podcast.
Yeah, thank you for having me. Happy to be here.
So why don't you start with just a little bit more of an introduction of yourself and the work you do?
Sure. Okay. So I am a Canadian licensed naturopathic doctor from Toronto, Canada. And as you said, I came back in 2008 and I've been practicing at IMI Clinic in Central. I have a special focus on women's health, in particular fertility, as well as children's health. And besides my practice, I also have a health blog. So I love sharing, the latest health news, the latest health research, and I'm also an author of a children's book called COVID-19 and You.
Amazing. You also left out one thing. You were also Wellness Woman of the Year in 2022 as well, right?
Yes, thank you. Yes.
And so why don't we start with just talking about what is naturopathic medicine and why is that even related to fertility?
Okay, so naturopathic medicine is a comprehensive, holistic, and personalized approach to healthcare. So naturopathic doctors, such as myself, we look at the underlying causes of illness. So we want to address all the factors that impact health and well-being, and we use evidence-based natural medicines and therapies to help the patient rebuild and restore health. Yeah, and on a side note, actually, licensed naturopathic physicians from Canada and the USA actually go through like medical training. So we're trained in the basic medical sciences like anatomy, pathology, pharmacology, and so our approach is very patient-centric as well as science-based.
Amazing. Yeah. And so when people talk about, I guess, naturopathic, what are the areas of focus you would say in this naturopathic medicine space?
Yeah, so we really want to treat the whole person. So it's not just like, dealing with symptoms. We actually want to address the underlying causes of illness. We also have emphasis on disease prevention, right? So it's not just like, let's just deal with this particular disease and that's it. We actually want to help you live your healthiest in all stages of life. And we do that by using, natural medicines such as nutraceuticals, botanical medicine, a little bit of traditional Chinese medicine, nutritional therapy, and lifestyle counseling.
Amazing. And so when it comes to areas of your life like stress management, like toxins, and all these things, it seems like that would be in your realm of practice.
Yes, definitely. So we know that when we are stressed and when we are unable to process excessive stress, what happens is it actually brings us, it makes us stay in this flight or fight mode. And in that mode, it's all about survival. right? So the reproductive system shuts down, the digestive system shuts down, right? Our sleep is all over the place. We don't have time for exercise or any sort of relaxation. And so it's really important for us to be able to, resolve any unnecessary stress. Yeah.
And so to anyone who's very new to this naturopathic practice, why don't you share with us a little, how do you work with traditional Western medicine? Like, do you work with also, I guess, normal, I don't want to say normal doctors, but like
Western medical doctors. Absolutely.
Doctors,
Yes,
and how does
yes.
that work?
Yeah, so we definitely work together. In Hong Kong, it really depends on the practitioner. I feel like in North America, they're more sort of welcome to this integrative type of medicine. But definitely, because, we know that health is more than just an absence of disease, right? Just like pregnancy is more than just the egg and the sperm coming together, right? So for example, let's take IVF, for example, right? So you've got, you're struggling with fertility, right? You've got this condition, so you're gonna seek Western medicine for it. And Western medicine it's very reactive in its approach, right? So it's like, okay, well, you can't get pregnant, let's put the egg and sperm together, right?
Yeah.
But then, as I said, like pregnancy is much more than that. There are so many other factors that impact, your ability to carry a baby to term. And I think naturopathic medicine sort of, it fills the holes and the gaps that perhaps Western medicine is missing.
Yeah, so let's talk about that. Let's dive into that.
Sure.
I think I like one of your blog posts where you wrote about how do you how do you help your body to be more baby ready, right? So
yes.
how would you, from your perspective, sort of measure that or think about when somebody's coming to you and say, I'm trying to conceive, I have been trying maybe for almost a year, I went to a doctor checkup, to a fertility specialist, and everything checks out, right?
Yes.
We hear that a lot of times, right?
Yeah.
How do you usually address this?
Okay, so I believe there are three aspects. I usually divide into three aspects. So the first one is just making sure that you have good lifestyle choices, right? So nutrition, are you eating right? Are you sleeping well? Are you exercising? Are you doing are you avoiding, recreational drugs or alcohol? Are you doing all the things you need in your life to, make sure that you're healthy?
Yeah.
That's number one. Number two is looking at supplementation, perhaps, to correct for nutrient deficiencies, right? Not everyone knows, but there are deficiencies of certain nutrients that can actually impact, your ability to carry a baby or your ability to conceive. And so we look at nutrient deficiencies and we correct them using supplementation. Another thing which is very popular now is how to improve egg quality. Right, and so we use supplementation to also do that, as well as rebalance hormones, if you're not sleeping right, or as you said, if, there's this high stress in your life, we use natural medicines and therapies to really help you recover from that stress. That's the second aspect. The third aspect is looking at underlying or hidden causes of fertility, okay? So this could be anywhere from inflammation in your body that is unregulated, right? We talk a lot about reproductive immunology, where there might be certain immune cells that may be, attacking the fertilized egg or preventing you from carrying a baby to term. So I do a lot of investigative work in that as well. Other things include things like gut health, right? And so that's like the third one. So there's three aspects, right? Your own lifestyle, and then supplementation to help boost fertility, and then looking at sort of, any underlying hidden causes that we haven't looked at that may be hindering pregnancy.
I think that's a really good high-level framework to think about the work you do and how naturopathic medicine could be helpful in the space of fertility. I think one follow-up question I would have in terms of when you're doing these investigations, how can you be more scientific? Like, what is your approach when you say, look at your lifestyle, look at whether you're maybe have underlying issues? How do you go about it so that, I guess, our audience can understand even though it's naturopathic, doesn't mean that it's
Yeah.
not scientific. What's your
right.
approach to it,
Yes.
such that it also aligns with like, you know, Western medicine and also Western doctors you collaborate with?
For sure, yeah. So the lab testing that we do, some of it is just conventional. So basically, medical doctors would be able to check off the boxes and do the same thing. So for example, testing for like folate, vitamin D, those things you can probably do with your medical doctor. We also do genetic testing, which is really looking at genetic functions, like how well your body is regulating or controlling certain aspects like DNA replication, DNA repair, how well your body is detoxifying, how well your body is dealing with oxidative stress, inflammation, etc.
Yeah.
So that is very different from circle DNA. So a lot of my patients are like, you know,
I've done a
you know,
circle DNA. I know my heritage.
Yeah,
I'm
yeah.
90% Chinese, and you know, maybe 10% something else, right?
Yeah, so the circle DNA is also a DNA test, but it looks for more sort of lifestyle, more interesting sort of factors. But the DNA test that we do is really looking at the genes that code for specific functions that are relevant for fertility or fertility-related conditions. Yeah.
So let's again maybe look even deeper into that. So when you talk about, let's start with lifestyle, right? And so hey, whether you're having a healthy lifestyle, from your experience and your in terms of your working with patients, looking to boost their fertility, what have been the most common sort of pitfalls or gaps that are in their lifestyle that you think are A, easy fixes, and also B, maybe easy misses? Easy to miss out, you didn't realize it was actually important. Yeah.
Okay. In Hong Kong, I know that we are very driven, right? We're very driven with data and research. And so I do see a lot of women coming in and they're like, Dr. Yik, I'm doing this,
Yeah,
and that
yeah.
already. But I think what's missing is the personalization of it all, right? So we do a little bit of, for example, we do a little bit of Chinese medicine as well. So we all know that we're all unique, right? And so the foods that you might eat may be different, you know, internally when you eat it. It's very different. It has a very different effect in me when I eat it. And so I think what they're missing might be more like a personalized approach, right? And so I do have some people who are like, oh, you know, I'm supposed to eat a lot of, say, eggs because
Yeah,
you know,
protein
protein
rich.
it's really good for us, right? For really good for you. But then afterwards, I might note that, hey, you've got a gut issue. So why don't we look for food allergies or food intolerances? And lo and behold, they're allergic to eggs. So then, you know, what happens then? So I'm there to help them navigate through all these things. Yeah, so it's really that personalized sort of approach that I feel a lot of Hong Kongers are missing.
Yeah, because when it comes to lifestyle, sometimes people are like, I've been trying to conceive, I've been doing healthy stuff, right? I've been eating fresh, I've been sleeping more, I've been doing some exercise, and they're like, you know, it seems like I just don't know where else I could potentially improve in terms of lifestyle, right? And A, there's a personalized aspect to it, but B, then we can investigate the other two areas, right?
sure,
That you
yes.
just talked about. And so when it comes to supplementation, what are the main, I don't know, vitamins or minerals or sort of antioxidants do you actually look at and investigate?
Yeah, well, for sure, everyone who wants to or is actively trying to conceive should be on a prenatal monthly vitamin that contains folate, okay? Because in the first trimester, folate is of utmost importance for just DNA replication as well as to prevent certain neural tube defects. And so that is number one, for sure, okay? And then secondly, we really need to look at the person, you know, how old they are. Do they need help in boosting egg quality? How well are they dealing with stress? Because we also, as I mentioned, you know, stress could have a negative impact on reproductive function. So if you have elevated levels of stress, how can
As measured in cortisol?
exactly, yes, cortisol. So we can do like a hormone testing for them. And then how can we help to regulate or decrease cortisol so that, you know, we are in a state where we are calm and relaxed when we should be calm and relaxed.
Yeah.
Right. So it really, once again, it depends on the person, but definitely I look at all the aspects. It's not just like, oh, well, one size fits all. No, because everyone is different. Everyone who comes into my practice is different. And so I will be taking that time to really look at each person and what they need.
Yeah. And then how about toxins? I know that you do talk a little bit about that in some of your blogs as well. When it comes to fertility, what are the things that we should watch out for, and why, is toxin testing maybe relevant in this case?
Yeah, so studies show that people, men and women, who have elevated heavy metal toxicity, they actually can't fall pregnant as easily as those without those elevated heavy metal toxicities. And the funny thing is not the funny thing, but the beautiful thing is that when these people go through a heavy metal detox, I don't remember the numbers, but, a bunch of them are able then to naturally conceive. And so we do know that heavy metals, they shouldn't belong in our body, and they do have a negative impact on fertility. For us, we do a hair mineral analysis as well as urine.
Okay.
Yeah, so what happens is we might get them to take a supplement to kind of push all of the toxins out from their cells. And this is not like a blood test, because blood tests would test for what levels are in your blood system right now, but we're more concerned about what is like stored in the body.
Oh, interesting.
Yeah.
So one is like in circulation in your blood, how
Yeah,
much
so that would
heavy metal
so
you
that
have.
would be more acute poisoning. So medical
I
doctors are
see.
great with that. Like if you suspect that you have acute heavy metal poisoning, you get a blood test done.
Right.
But then
Which
if we're-
rarely happens to most people.
Not in Hong
right?
Kong. Yeah.
Oh, I see.
yeah.
That makes a difference. So, and then, so your process of, doing a urine test or a hair test.
So for the hair, what we're looking for is, because any excessive heavy metals will be excreted out somewhere, and so slowly through the hair. So we would do just the base of the hair. Yeah.
Oh,
yeah.
wow. And so by finding that out, then again, it's an indicator, is helpful information, indicator to see, hey, is heavy metal toxicity high, maybe that is something that's interfering with your ability to conceive, right? And I think even if I'm not looking to actively conceive, I think that's a good thing to know. If
It is,
at a cellular level, I am very high in heavy metal toxins, right?
Yeah, for sure. Yes,
I see.
yes.
So some of the conversations I've had with gynecologists or fertility specialists in Hong Kong, I do find they have different approach or acceptance from the nutrition and supplements perspective, because we do sometimes ask them, hey, do you think your patient should be taking, for example, prenatal vitamins for, support them trying to conceive? Things like you said, folic acid, but vitamin D and even maybe DHEA and things like that. I found them sometimes have different acceptance levels. Would you be able to help us understand that? And what have you found in terms of your experience working in Hong Kong, in terms of your collaboration with other doctors?
The first thing is, I guess the research is out there, but as I said, Western medicine is very reactive in its approach, and so I feel like they're very focused on, okay, this is the condition, so this is the medicine or the procedure that's going to help correct that condition. But what they're not seeing is, especially for fertility, it's not that simple. There are so many different aspects that affect our ability to conceive and then our ability to carry a baby to term. So I feel like, I guess that's why I get, my patients
Clients.
coming into my
Patients,
practice, right?
Yeah.
And I mean, even just last week, Harvard came out with a study saying that, billions of people around the world have nutrient deficiencies, and this has a negative impact on their health. And this is Harvard study coming out saying this. And so, let's not even talk about fertility, right? Let's talk about our normal functions of the body, right? That could be impeded because of these nutrient deficiencies.
Yeah. I guess when we're talking about, fertility is something, or trying to conceive, having a baby, your body does have to be in a more optimal state in order to procreate, right? If you, like you said, if you're in a flight or fight mode, your nutrition is suboptimal, I guess, and naturally your body's going to be like, hey, I need more before I can go procreate, right?
Yes,
so that makes a
for
lot of
sure.
sense. Then the next aspect, so supplementation, and then the last one is around genetic testing, right?
Yeah, there's genetic testing, there's reproductive immunology, so that's pretty new. And that's really looking at your immune cell profile and seeing if any cells are elevated that could be detrimental to fertility. So that's really new, and I'm really happy to see that. So some of my patients have tried IVF in Hong Kong, and then they're like, okay, it's not working. So then, they see me, and then they're like, I'm going elsewhere. And it's really comforting to hear that, they come back or they email me, they're like, Dr. Yik, like all the tests they wanted me to do, you did it for me already. So it's, you're a lifesaver because you've saved me a lot of money, like to do things over there. And so I know that even, fertility specialists outside of Hong Kong may be really looking at these things, because what we're trying to do is really boost your chances of success.
Yeah.
Right? If IVF doesn't work the first time, the second time, third time, we really need to kind of maybe change the way we're looking at things, right? And so I feel like by really looking deeper into underlying causes, I think that will really help the patient improve their chances.
And I think when you talked about immunology and all these things, I think another related topic, inflammation, comes up. We had an earlier guest on the podcast, and she talked about before her egg freezing process, she really did a deep cleanse and anti-inflammation diet, because she was at a not very great health for a while, where she was having insomnia and all different things, and her anti-inflammation diet, she believes really helped adjust for that. And then also as she continued into her egg freezing, she had pretty good egg quality. So that's one qualitative example. But how does inflammation sort of tie into part of what we're talking about?
Yeah, so inflammation is sort of the trigger for a lot of chronic illnesses. Okay, and so let's start from the beginning. Like if you've got like cervical inflammation, which is easily detected on the pap smear, but when I look and when I ask patients, hey, did your OB tell you that you've got a little bit of cervical inflammation? They're like, no. And so we know that cervical inflammation will actually hinder the sperm from even swimming in, because you've got all of these inflamed cells, right? So even there, inflammation is already like, it puts a damper on the whole fertility process. We also know that if there is excessive inflammation, or if inflammation is unregulated, even with a fertilized egg, right, your body might be shooting out inflammatory markers or cytokines to be attacking the fertilized egg even before implantation or during implantation in the beginning stages of pregnancy. And so definitely we want to be, making sure that inflammation is regulated well. And that's one of the things we look at on the DNA test, the genetic testing, to see if genetically, you've got issues with regulating inflammation. And if that's the case, then we would help you using nutraceuticals, herbal medicine, and also stress management techniques to really help bring that inflammation down.
Great. And when you talked about like how potentially if you got inflammation, then your embryo may not be able to implant properly, is that one of the causes of miscarriages that we see? Is that what influences sort of miscarriage risk?
That could be OBs who tell their patients, hey, if you're pregnant, take a baby aspirin, right? And what does that baby aspirin do? Well, it has that anti-inflammatory effect as well. So medical doctors they might find certain things that work, but they might not be able to explain it to the patient either, because as I said, they're very focused on, medicines and
treatments,
procedures.
Right?
Yeah.
We see that as well, and that's why as part of my work with So Fertility, a lot of times we love to empower our members and just with education information so that they know what to look out for. And if they believe, hey, in part of this fertility process and journey, I want to look for more than just IVF, IUI, these type of treatments. Maybe I want to explore some more of the underlying causes, or some of these treatment hasn't been as effective and we haven't been able to find out exactly why. It may be good to think about different aspects and sort of approach it from a more holistic approach. But I also understand it could be quite frustrating, because it's not like one pill, I take it, I'm done with it, right? What we're talking about just now covered a whole spectrum of lifestyles changes to investigations to all these things, and it just seems like it could be a lot, I think, sometimes. So how do you, when you work with patients, how do you manage the expectations when it comes to these types of investigations and to help them go on a maybe already quite challenging fertility journey?
Yeah, well, I think I'm just there to support and educate, as you said. I feel that education is key. And of course, they can choose, right? I mean, some people, they're like, well, I'll still have my alcohol, but I'll be very good with, certain other things. And so I think it's really, I'm like the facilitator, and I give them the ball, the responsibility, and I say, look, this is everything that I feel you need to investigate. And if you want to go that route, we can definitely go that route. I feel like these are the things that you should do. And I usually prioritize them as well because, as you know, like a lot of patients, they do come in and they're like, 20 different supplements, what do I actually need, right? So we prioritize. And that's the beauty of doing those very comprehensive lab testings to see what you need. Because what you need doesn't necessarily mean that the next person, like the person next to you needs that too.
Yeah.
And so I feel like, just really giving them the freedom, right? To say, look, this is all the information here. How do you want me to help you? And really supporting them. I feel like it's a lonely journey, I feel, especially in Hong Kong. We tend to, maybe it's the Asian culture, but we tend to shy away from talking about fertility or fertility issues. And so I become sort of that coach, that advocate, that coach,
which
to
is
say
amazing
you can do it.
in terms of the work you do. So when you talked about in your work that maybe different solutions apply for different people, how does it differ for men to women? Have you seen when it comes to again trying to conceive, fertility? What has your solution been like?
Okay, so men and women are very different in nature. And so I would say that what's different is usually the woman is the sort of driver in that household, right? So the nutritional changes, the dietary changes, the supplement compliance usually.
Yes.
Yeah.
Oh, I had members tell me in the morning,
Yeah.
she's the one who takes out all the supplements and put on a table next to the breakfast for the husband.
Yeah, absolutely. So, but for the men too, I feel like when we do testing, and of course testing it's the same. It's genetic. Obviously, I might do a sperm analysis with them as well, semen analysis. But it's also very similar. I'm very similar in approach where it's very personalized, right? So if there's stress that I need to manage or that the person needs to manage, then I help them by giving them perhaps nutraceuticals or advice on how to manage stress.
So for men, when you see them with low, sperm quality, what are some specific advice from your perspective that you think has been helpful?
There are certain minerals, like nutrients, that can really help to improve sperm quality, be it like morphology as well as motility. Off the top of my head, I would say, make sure that you're having like a high dose zinc and selenium, folate as well, and then CoQ10, like ubiquinol. The activated form of CoQ10. I would say that these things are a good start.
Great.
Yeah.
And then besides sperm quality, sometimes it's also like, does inflammation also matter for men when it comes to fertility? Because when we talk about women, we talk about because the uterine environment and whatnot, inflammation. I can completely get that. But for men, is that something they need to watch out for as well?
I would say indirectly for the sperm quality. So for men, it's really that
sperm. We need that seedling to be very healthy and optimal.
Absolutely. And just making sure that, they are taking good care of themselves and making sure that, they've got good hygiene and they're not just sitting around in very tight underwear. So I usually say, look, wear boxers, and at home, if you're free to, just kind of
air it out.
Yeah. Yes.
So why don't we go into some patient experiences and stories? Like, I know you have a natural fertility program that you use to support patients. Could you share some sort of success cases or some tricky cases that you're very proud of?
One of the cases that comes to mind would be my patient who was 50 years old when she came to see me.
Male or female?
Female, and she had tried IVF for at least 7-8 times already, and she was like, look, this is my last straw because of my age. Like, I'm going to try naturopathic medicine, and then I'm going to try one more time.
Yeah.
And so I did help her, through lifestyle changes and, just boosting everything. And then at the end, she gave birth to twins.
Oh, wow.
Yeah. And then they became, they ended up coming to see me too for other health issues.
Yeah.
But I feel like, a lot of people say, oh, I'm turning 40, is this, going to be, and I say, absolutely. It's really looking at, as I said, like all the factors that are impacting your fertility and your ability to conceive and carry a baby to term, and really helping to address it so that, every aspect is optimal.
Yeah, we talk a lot about the trying to conceive part. So how does your work then extend into pregnancy? Because you said not all fertilized egg end up unfortunately, into a live birth. So besides the trying to conceive, let's say a patient now as being successfully, okay, get 2 lines on a pregnancy test. How do you continuously support them to full term?
Yeah, so there are different nutrients needed for each trimester. So I make sure that, they're on top of things. And of course, in the first trimester, sometimes women will experience, nausea and vomiting. And so I'm there to support them as well. I think for me, I really try my best to make sure that the first trimester is as smooth as possible. So making sure that from an inflammation perspective, that their bodies are regulating inflammation the right way, making sure that they have all the nutrients that they need and they are eating right, not only for their health, but also for their constitution. So from a Chinese medicine perspective, it's perhaps avoiding certain foods or maybe eating more of certain foods or maybe having certain teas or certain soups. And so once again, it's very personalized, but definitely, that the care is there. So I'm there to really, be with them on this fertility and pregnancy journey.
When we talked about patients, you talked about, somebody that's older in age, 50 years old. Have you seen younger patients come to you nowadays? Because what I've seen in my work is that it seems like we are looking at fertility issues a little now younger in age. Have you seen that, and what are some typical issues that has contributed, you think, to the trend of fertility issues coming up when you're younger?
Yeah. So I see a wide range of patients, younger and older. It's going back to the nutrient deficiencies, right? And it's not necessarily just about eating right. It's about whether or not you're able to digest the food and able to absorb the nutrients. And so that is something I also look at, because if you're in your 30s and you're eating right, but yet on a lab test, you're deficient, then I know, okay, something's going on with, maybe your gut or maybe the digestive process. Okay, and so that's one thing. Another thing, as I mentioned, would be reproductive immunology. So immune cells elevated or maybe inflammation being elevated. High stress can also increase inflammation. And
we're
so
definitely hearing all these recurring themes.
Definitely,
right?
yeah. So looking at all of those things and seeing what we need to address in that person, I feel. And a lot of Hong Kong people actually do have, bloating or digestive related issues. And this could be stemming anywhere from, just indigestion or acid reflux, SIBO, so small intestinal bacterial overgrowth. That's a big thing recently that people are starting to realize and then coming in and asking for the test and then testing positive. So let's just use SIBO for an example. So when you've got a small intestinal bacterial overgrowth, what happens is the bacteria that's not supposed to be there is there. And what it does is it actually hinders absorption of nutrients, especially, I think, B12. And so we all know that B vitamins help us to convert food into energy. It helps us to, it helps us for DNA repair and replication. And so a simple, just SIBO could actually lead to certain nutrient deficiencies.
Oh,
and so, we really need to be looking at not only, I guess, the sort of the, how do I say, like the cover of things, but we actually have to look at internally, underlying. Yeah, so that's what I mean by, looking at all the factors.
Yeah. That's actually quite fascinating. You wouldn't have thought, oh, I have a bloating problem. And then it's like that relates to maybe potentially a fertility problem, right?
Possibly.
I guess it's something I would have thought jump. Through, it's like a completely different organ.
Yeah.
You would have thought, right?
Yeah.
And then again, that's why we're saying, whether it's traditional Chinese medicine or naturopathic medicine, we sort of take a more holistic approach, and then we couple it with, obviously, the Western medicine where we've got more intervention type of treatments. Hopefully, then we can provide a more holistic type of care and options, really.
For sure.
Like then whoever then needs that type of spectrum of care can then have access to different toolkits. And
yes, absolutely. Yeah. Okay.
So before we wrap up, can you share with us a few myths that you would want to debunk when it relates to naturopathic medicine or things you've seen in your work?
I think the first one I want to address is, are we science-based? And I'm going to say that licensed naturopathic doctors from North America, because North American naturopathic doctors are the only ones in the world that are actually licensed. So we have to go through 2 sets of licensing exams. We get licensed in our jurisdiction, right? So it's actually just like a medical doctor or practitioner. And so for us, we hold ourselves high in providing quality science-based care. But in Hong Kong, because there's no regulations, so then anyone can call themselves like a naturopath or a naturopathic doctor, and then they can be prescribing God knows what. And so I feel like that might be a struggle that, a licensed naturopathic doctor such as myself has to, work with.
Yeah.
Another thing is it would be nice if more Western medical doctors understand what we do. So a lot of times, because they don't know what we do, there's no education for them. They're like, oh, okay, just don't touch it because, well, we don't know what they're, doing. But once again, because North American licensed naturopathic doctors, we do have that basic medical training. And so I guess I would like to see more of that collaboration.
Yeah, I would love to see more of that as well. Yeah, definitely. Well, it's been amazing. So thank you so much for joining us today. I've learned so much about naturopathic medicine, and I'm really looking forward that we can collaborate more and see how we can bring more of your expertise to some of our members at So Fertility.
Yeah, thank you for having me today.
Thank you, Ardyce.
Yeah,
thank you so much. Thank you for tuning in today. Subscribe to our channel wherever you are so you will never miss our episodes when they drop. Be sure to share our podcast with your friends so that we can break the taboo on fertility together. Don't forget to follow us on our social media channels to stay up to date on the latest moves of So Fertility and get tips in navigating your fertility journey. I am Dawn Chan, and we will see you next time at How Would You Like Your Eggs podcast.